raise the standards for the quality of minutes.
You have to understand, when I was teaching, I was appalled at the poor quality of grammar and spelling in the graduate level.
Yep.
Oh, yeah.
I fully support you, Paula.
Pet peeve of mine.
Same.
Okay, so I make a motion to approve the minutes of May 9th and May 20th. Do I have a second?
Second.
Paula, second. Roll call. Carrie?
Yes.
Kevin?
Yes.
Joan?
Yes.
Paula?
Yes.
And Rick, yes. So the minutes are approved. Okay, so in terms of our next agenda item on the Community Health Improvement Plan, I guess Jamie won't be joining us. And really the purpose of putting this on the agenda was that Erica McNamara had some edits that she recommended for the improvement plan, which were sent to you in the pre-board packet. Basically, I think the edits were intended to not duplicate efforts to deal with substance abuse and mental health issues in the town, and sort of lean towards more collaboration with the Board of Health and potentially with, in time, with our colleagues to the north in our collaboration. I don't know if anybody had any comments on that. If we decide to take a vote, it would really be more to endorse both the community health needs assessment and the CHIP. Although clearly it's not totally up to the Board of Health and the Health Department to get this done. It really is going to require a broad collaboration. So were there any comments on the edits that Erica had suggested?
No.
No comment.
Okay. Do you think we need to take a vote to endorse this or not? I'm actually not 100% sure. What do people think?
Did we previously vote to incorporate it?
Well, we certainly voted to start the process, and we've been deeply involved in it. I guess in my mind, if we voted to endorse it, it sort of puts a stake in the ground that we're on board with this and, to move it ahead. And so that would be a reason to, as opposed to it just being another consultant's report that flies by our desks. So, on that basis, I would suggest we vote to endorse it.
Yeah, the whole thing, not just the edits.
No, exactly, the whole thing.
Okay, that's what I was getting at. If you've already previously voted to endorse it, you just need to vote on the edits. But you can just simply say, vote to adopt this as amended.
Okay.
That'll cover it.
Is that a motion, Kevin?
That's a motion.
Okay, I'll second it. Roll call. Carrie?
Yes.
Kevin?
Yes.
Joan?
Yes.
Paula?
Yes.
And Rick, yes. Okay. I think the next steps on this is that Jamie, and correct me if I'm wrong, Ade, but I think Jamie's going to have it, fully printed in its final format and distributed. And then we're going to need to work together to develop an operational plan, whether we have a coordinating committee, whether we have a coordinator for the position for this, how we're going to lay it out. That'll be the next piece of work. That'll be a good piece of work too. All right, so next on the agenda is the is the nicotine-free generation tobacco regulation amendment. And, this I know has been somewhat controversial, but we've been talking about it for the last several months. We had the hearing on May 23rd, and I think it's really time for us to make a decision on it. So what I've done, what I would like to do is I would like to kind of spend a little bit of time talking about this amendment from my perspective and, where we've been, what my thoughts are around this. And then we're going to kind of go round robin, and I would ask every member to, to comment and give their thoughts as well. So it'll probably take me 5 or 10 minutes to walk through this. So bear with me. So first of all, I'd like to thank all the residents and interested parties who expressed their thoughts and gave us feedback. And I'm going to refer to this as NFG, just as an abbreviation. Participating in the process is very important for a healthy community. And while we may not all agree, open discussion and debate is helpful. I read every single email, and we got over 200. A few from Reading, many from across the state, and a few from out of state. And I listened to the entire hearing on May 23rd, so I think I have a good idea of the issues that have been raised. So just to be clear on the process that we've gone through, in addition to soliciting emails prior to the hearing, and frankly, we've accepted them after the hearing, the board elected to have a public hearing on this matter, although we actually weren't required by law to do so. A second hearing was requested, but I declined to offer one because the first one was well publicized. We met all the legal requirements, and it was well attended and well chaired by Carrie, I may mention as well. There was really no need for a second hearing nor additional public comment on this matter for this meeting, in my opinion. So, and finally, just to be clear, the amendment to the Town of Reading tobacco regulations that we're considering tonight only forbids the commercial sale of tobacco and nicotine products to those born after January 1st, 2004. But it doesn't prohibit the purchase, use, or possession of tobacco or nicotine products, meaning the act of smoking is not criminalized or forbidden in any way. It's just the sale of products to certain individuals. As I thought about all the feedback I received, we all received, actually, I sort of dissected it into 3 lines of thought. First is what we all agree on. Second is where are there reasonable questions and doubt about the impact of the amendment? And then lastly, this whole issue of personal freedom, choice, autonomy, and the role of the board. So those are the 3 areas I just want to walk through and give everyone, the public, as well as the board members, my perspective. In terms of what we all agree on, I would say virtually everybody agrees on 2 points. One is that tobacco and nicotine use is unhealthy, and it's a leading cause of illness, disability, and death via its impact on the circulation system, like heart attack, stroke, peripheral circulation problems, as well as a risk factor for multiple cancers. Not only lung, but, cancers of the mouth, throat, the esophagus, the stomach, pancreas, colon, and bladder are all increased in smokers. And to some degree in nicotine users, although the data is less there. So even some of the most ardent detractors of the policy admitted in testimony that it's a dirty and disgusting habit, but that's not the reason we're doing this policy. policy is really on the health of the public in the town of Reading. The second issue, which I think everybody agrees, is that really no one thinks or publicly supports the use of tobacco and nicotine in underage children, now defined as under the age of 21. So there are a couple areas we can all agree on, regardless of one's position on this policy. There are a couple areas where, people have reason to disagree because the future impact cannot be accurately predicted. And so the first of these is really what would be the impact of the policy on the retailers of tobacco and nicotine in the town. On one hand, prohibiting tobacco and nicotine will undoubtedly impact the business as the customer base slowly declines over decades and users go out of town or out of state to purchase their products. On the other hand, the change in the customer base is very, very slow, allowing a lot of time for retailers to innovate around other products that they can sell. We've certainly heard from businesses, actually, that businesses would close and be impacted when flavored products were prohibited or when the age of sale went from 18 to 21 a few years ago, but very few, if any, of those happened. So I think in terms of the impact on retailers in the town, specifically, I think that given the slow pace of the change, it's not clear whether it's really going to have a business impact that I think a lot of retailers are concerned about. The second of these uncertainties is what the policy will have on the use of these products under 21, on people under 21. So in speaking to those closer to the situation in the schools, it appears that youth under 21 obtain access to tobacco and nicotine mainly through three ways. One is their social circle, from friends and relatives who are just over 21 and still in their sort of social circle, their older siblings, their siblings' friends, and so forth. The second is online sales. And I was shocked to see, because I looked, that a lot of this can be purchased online. And then lastly, adults who illegally traffic these to minors. I think this policy will only slowly impact the first method, the social circle, because over time, the people who have legal access to purchasing this will become older and older and older, and not in the social circle of a 17-year-old or a 15-year-old. I think that adults who sell to minors and online sales will not be impacted. Okay, so whether there'll be a booming illegal black market for nicotine and tobacco, I think is debatable. We don't really know. What we do know is that 8 to 12% of Reading children in middle and high school currently use nicotine and tobacco products. And this is in a survey from a year ago. So that's 8 to 12%. And while that's a lot lower than it was a decade ago, a lot because of restricting the age to 21, it does represent 1 to 200 children who likely will be addicted for the rest of their lives to nicotine and suffer the consequences to their health. Anything, in my opinion, anything we can do to reduce even a small number of underage users is worthwhile. So is it going to impact under 21? It's complicated. And I think my personal opinion is there's a good chance there would be some improvement and potentially a significant improvement down the line in decades. The third, and probably the most hotly debated issue, was that of personal freedom, choice, the role of the board in restricting tobacco and nicotine permanently, which are legal products. here's where, there was a lot of passionate disagreement. And, as an American, personal choice, personal freedom is very important, certainly to me, and gave me pause to really think about this. There has always been tension, I think, in this country, certainly in public health, between those desiring no limits on personal freedom and those willing to balance personal freedom with what the U.S. Constitution says is, quote, promoting the general welfare of the country, which I think is what we as a board are doing or trying to do. So there's a number of issues that, as I dissected the 200 emails and listened to the hearing, a few issues to try to sort this out. Okay, so one is, some have said that this policy represents an overreach of the board. And, the Massachusetts Supreme Judicial Court disagrees, and stating in their March 2024 decision, quote, "The bylaw is rationally related to a legitimate government interest and does not violate the equal protection of Article 1 of the Massachusetts Declaration of Rights." It ruled that local boards are well within their rights to enhance state laws in their community as long as they meet a minimum state standard. And certainly there's no U.S. constitutional right to nicotine and tobacco. So, my perspective is the board has legitimate interests in this in terms of public health. We have a role to play. One may disagree about this, but I think the courts have ruled on it. So another concern that was raised was that this policy would create two distinct groups of adults, those that can purchase nicotine and tobacco and those that cannot, and that this was somehow discriminatory. It will create two different groups, but there's a well-established legal approach referred to as grandfathering. And grandfathering identifies dates or birthdays or situations in which, prior to a new regulation or law, the previous condition may exist, but subsequent conditions or situations must conform to the new regulation or statute. This is what grandfathering is. And it's seen in, zoning, it's seen in building codes, it's seen in tax law, and a lot of other situations. It basically is a way to transition from one set, from a previous condition or a set of rules or regulations or statutes to a new set, by grandfathering in the previous group or situation or people and applying certain new rules to the new group. This has been done for eons in this country. It's done all the time. It's not viewed as discriminatory or illegal by the courts. So the idea of having two separate groups is simply one of the things that this policy will in fact do, but it's done in many other legal situations. Another commonly raised concern is the slippery slope argument. And this is a rhetorical argument, and these are either commonly called in debate societies as either reductio ad absurdum or whataboutism. And an example of reductio ad absurdum would be, the next thing you know, they'll prohibit the sale of ice cream and Twinkies to those people who are obese. And we actually heard this in some of the statements made. An example of whataboutism would be, well, what about alcohol and marijuana? Are they next? You're going to prohibit them from being sold? In both arguments, as I think about it, the tobacco and nicotine issue is taken way out of context, and extreme examples are generated that really provoke and inflame rather than carefully and rationally consider the context of the problem. In terms of the context is really, what can we do about the scourge of nicotine and tobacco today, given our history, culture, the use in the community, and scientific knowledge? To the what about alcohol and marijuana, I would say, what about heroin and cocaine and meth? Why aren't people advocating for their right to use these substances based on personal choice? They actually kill fewer people each year in this country than those impacted by the long-term effects of nicotine and tobacco. So you can see, the what about approach, although it's very rhetorical, doesn't really help us rationally decide this particular issue. And in terms of the Twinkie and ice cream argument, well, I think that's a little bit absurd, not worth commenting on. And then finally, and I'll wrap up with this, the argument is made that adults have the right to personal choice, or use or not use, and the government shouldn't interfere with that right. Here I question the concept of choice in the context of an addictive substance. Like other addictive substances that the government has prohibited, nicotine is highly addictive within weeks of sustained use, much more addictive than alcohol and marijuana. And when addicted, the whole concept of personal choice, in my mind, is questioned. When there's a biological addiction, the issue of personal choice, I can do or not do, is a little bit really sort of doesn't fit with that. When underage children become addicted, science has shown that the impact on their brains makes it even harder for them to quit because of the nicotine effect on the receptor cells in their brain. And statistics show that addicted underage children are more likely to use other substances that are illegal. In fact, studies have shown that 9 out of 10 adult users started when they were under 18, and the vast majority of adult users have tried to quit at least once, and many have tried to quit many times. These facts don't sound to me like these individuals are making personal choices of their free will to use nicotine or tobacco, but rather they're trapped in nicotine addiction against their free will. So, for all these reasons, to me, the weight of the evidence and the rationale for the policy, demands that I vote in favor of this amendment to our current tobacco regulations. I would now ask, sort of, maybe we'll go around, and I know that was a little bit long-winded, but I thought it was important to sort of get some of these issues out on the table because we've heard so much. And, maybe go around to each board member and, solicit their perceptions and thoughts about this whole issue. So maybe we could start with Carrie.
Thank you, Rick. And I agree that this is an important question. I will say there was at least one suggestion during testimony at our hearing that members of the board had already had their minds made up. And I think it's important to understand that I can't speak for my other fellow board members, but the practice of public health is not one where we make decisions and then find the data to support it. It's a process of considering all of the different impacts and weighing the merits and weighing the question of whether, the impact on population health is significant enough to tip the balance versus consideration of individual rights, right? And I think one example of that, actually, I read so I read a lot of things, like you, Rick. I read a lot of things in preparation for this. I looked at the reg. I looked at our community health improvement plan that we just supported, and I looked at the process. We went through it. I reviewed every document that was sent to us, every email from all over the country. Lots of emails from folks outside of Reading and outside of Massachusetts. I looked at the Mass Supreme Judicial Court decision. I reviewed the testimony. I reviewed the notes that I took. I listened carefully during testimony, and and made my own notes and reviewed those notes to make sure I understood what the issues were. I really appreciated everyone's willingness to come and speak and share their perspective. It's really important. It's an important part of the public health and policy making process. You know, and I look to thinking about, so what is the charge of public health? Our charge is to prevent and protect the health of the public. We're not practitioners. We're not, we're not acting as nurses or doctors who are treating people who are experienced disease or ill health. We're looking at how do we prevent ill health? How do we encourage circumstances that either provide for better health or support people's choices to be healthy? And, you know, looking at that, we're talking about enabling conditions for a healthy life. And prevention is a lot of how we do our work, right? We do a lot of education. We do a lot of encouraging healthy behaviors, making the healthy choice the easier choice through programming and awareness raising. And then we do inspections, and we do regulation. And, you know, I don't think public health ever goes to regulation first. And ever is a big word, so I probably shouldn't say that. But that's not, you know, that's not the bent, right? So you have to look at what are the efforts that have been made to prevent, and are they working? And you have to look at what the population impact is. And Rick, you've done a great job of going through the impacts on population health, the astounding numbers of people who contract an astounding range of disease. And that serves to increase healthcare demand. It increases healthcare spending. It's not creating conditions for health. We looked at, you know, what we talked about in our CHIP and our community health assessment. We talked about wanting to build resilience in young people and encourage their healthy lives in the future. And we talked about increasing healthy behaviors across the lifespan. And I think that looking at a adoption of this regulation in that context does make sense. So I want to say too that I did think about, like you, the economic piece. I certainly understand the words we heard from different business people. I worked in small business for a number of years before I came to public health. And I understand that, but I also remember, you know, I did a little research and look back, and I remember when smoke-free workplace was a topic in the early 2000s. And a lot of restaurants were very, very concerned. They said, if you make it so people can't smoke in my restaurant, I will lose business. They will go to the next town over. I will go out of business. And what happened actually was that businesses showed they had an increase in people being there because there was smoke-free environment, right? So, and I'm not, I don't think it's a direct analogy, but there are fears and concerns, and then the sort of how does the fear and concern play out isn't necessarily quite as dire as folks generally expect. And while I value and the economic piece, and while I do consider business impact, you know, I can't put more weight on that than the population health and the numbers of folks who become addicted to a product that is designed to be addictive. And as the restrictions have come in on different types of tobacco and nicotine products, we have learned that the products are being designed to provide more nicotine. They're being designed to be absorbed more readily so that they become addictive even more quickly than the traditional routes. And that for me is the piece that goes against this. The notion someone suggested that we ought to be thinking about my body, my choice. And I agree, it's not a choice. And it is because the purveyors of these products are deliberately creating a market for themselves by selling more and more addictive products. And I think that, in these circumstances, the only sensible action to me, if we're going to protect the public's health and follow our charge, is to vote to accept this amendment. It was a tough decision. It was not one that I had made on May 23rd. I've spent a lot of time thinking about this and talking with people in support and opposed and unsure ever since then. And I appreciate the chance to talk about what that, how my thought process, and I appreciate the chance to have heard from the public and now make our decision. Thanks.
Thank you, Carrie. Kevin.
All right. So I actually started out in this process thinking it was a pretty good idea. I think when Maureen first brought it to us, it seemed like a very simple idea, but everything always tends to seem that way until you, as Rick, you did, and Carrie, you did, really look at it from every which angle and come back at. I have to say there's one thing I can't get past on this one, and that is, will it really have the effect that it is intended to have? In other words, I know the structural part of it is designed to prevent those born on or after that date to be able to purchase the products, but the product will assuredly make their way into their hands one way or the other, right? So I have a hard time implementing things that don't actually have a good effect in the end. In other words, you're going to implement this and you'd hope that from doing something like this, you would have a great effect. And I don't even know if you could have a great effect 100 years from now. It's tough to say that. It's tough to, I can't get past a couple of things. One, that a 21-year-old isn't waking up on their 21st birthday thinking about picking up smoking because now they can purchase the product. That's not happening. I'm assuming. I'll take that's a leap. It's a big assumption, but I doubt that that's happening. They usually have been using tobacco and nicotine products prior to getting to that point. For a town like Reading, and then for Massachusetts to follow suit when they changed the age to 21, obviously that changed how they were able to get that product into their hands. As you alluded to earlier, it's through online. I didn't even know about that one, Rick. That's a news to me. I don't know how you get past that one, but oh well. Or other means, right? So this to me doesn't feel like it's going to generate the difference maker that it's intended to. And because of that, I have a hard time wanting to get on board with something like this. Quite frankly, what you mentioned earlier, Rick, I'd be more on board with. If you're under 21 in the town of Reading and in possession and use, let's work with the police department and a day, and let's come up with some kind of policy that addresses that, whether it be citation or what have you. I mean, if you really want to affect a greater change in the youth, that has a bigger effect on it. And I also, with how much it's declined in youth since the 70s as a big difference maker, I think education has been the leading causation of that. And I think that's where, if you are having like a citation system, it's the same as an education system, where it's really just saying, you're not supposed to have this product. You shouldn't have been able to purchase this product in Massachusetts, right? I think that something like that, while it's complex, I think it affects it more than what this policy would. So, I went round back and forth on all sides of this issue. That was the one thing I couldn't get past, though. I just don't think it's going to affect what you think it's going to. I think the same amount of people that are smoking after that, after it goes into effect, are still going to smoke. I think new smokers are still going to pick it up because it's going to be readily available from one source or another. And because of that, it feels like we're doing it. It's almost like a statement. We're making more of a statement than we're actually doing public health in a positive way. And you know, I don't have feelings on if the state does it one way or another. I'd be interested to see that kind of debate if the state would take this on and do it at their level. I think at least on the minimum, getting back to the economic part of it, I didn't really consider the economic part of it very well, other than that would be more equitable if the state took it on, much like they took on age 21. Beyond that, I mean, I don't know. You know, again, I know convenience stores don't want to hear that, but we're in public health. You know, that's first and foremost. So to me, I'm just not getting enough return for this kind of amendment. And I definitely, to the folks, what you said earlier, Rick, it's not an overreach. We can do this. The Board of Health is absolutely within their realm to go ahead and do this, and it's backed up by the court. So, you know, overreach isn't the right term. I just don't think you're getting the benefit from it. I don't see it changing the narrative out there. The one thing that we've never been able to do, and probably never will be able to do, is you're not going to legislate human behavior. It will adapt, it will move around your policy, and it'll still be in place. So now you have a policy that has effect in the realm of the business world, but no effect in the realm of health. That's my fear from something like this. I can't get on board because I can't see it actually decreasing. Education, definitely a decrease. Some kind of policy where if you're in possession of it, there's a citation. I think that over time would certainly deter people from having it. So that to me is a better conversation to have in this one. So I'm just not in favor of this. The other part that I would probably, and I really thought about this the last couple of days, we've had people speak in favor of it. Most notably our own tobacco expert, Maureen Busby. But I haven't heard somebody come out with compelling arguments against it. As a board member, I'd like to hear both sides of the argument. There must be professionals out there that not are lobbyists, not somebody that has a stake in the game, but somebody that is in governance and understands public health, that must have some arguments against it that we haven't considered. I think this is a really large amendment to take on by volunteers without first hearing from pros and cons from professionals in the industry. So, you know, I would say if you're in favor of this, I think you should at least have a vote set up for another meeting, bring in professionals that we can ask questions of, that can give us both sides of the policy, what it looks like, what are the effects, what's been going on in the current towns that it's been instituted in. I know there's probably almost zero to little data on that because it's so recent. You know, has any other countries taken this on already? Saw good and positive effects of it. I'd really like that full picture, which I don't feel like I've been able to find or get as a board member. So that's my feelings on it. I think we should move it to another night and set up a panel and have a robust discussion in that regard. I always just fear what we don't know when we do something like this, and the unintended consequences of it. That's my feelings on it, and I appreciate you listening.
Thank you, Kevin. Appreciate it. Paula.
Thank you. I too have paid attention to all the emails and literature and data that has been sent our way. And I have been thoughtfully trying to weigh the pros and cons of it. I agree that one of my struggles has also been personal freedom. But then I thought about things like helmets for motorcycles, which to me is kind of on the same level in terms of mitigating harm to individuals And that has worked out well. We've also had since the 90s, when I was a public health nurse here in the town of Reading, and the taxes were instituted on cigarettes. We've used those taxes for years for education. I helped with smoking cessation programs, which was a very frustrating thing for me to do because, and I'm not preaching to the choir, this is for the public. We've mentioned the idea of addiction of nicotine, how addictive it is. The truth is that it is as addictive, if not more so, than heroin. And as Rick indicated, that's where we have to step in as public health, as a board of public health, to mitigate harm to the public. That is our duty. That's what we commit to do. The idea of the lack of knowing how much this is going to benefit us, we're going to have to try. We have nowhere else to go but to try. And once we have data, then we have something to deal with. And try in the process of trying, the goal, to my perspective, is to try and get it to go to the state level so that we can have it across the board and have it more equitable for everyone. So I do see I absolutely understand where people are coming from when they feel that their rights are being infringed upon. But as a member of the public, our rights are being infringed upon too, because it is our insurance policies that are paying for all these illnesses that Rick so eloquently listed. Not that this will go away with the use of tobacco. I'm not suggesting that that would happen, but we will see a decrease in some of those diseases and health issues if we help the public to continue to educate them, but with the idea that it's as addictive as heroin, enabling them to try and decrease the use of nicotine. Thank you.
Thank you, Paula. Appreciate it. Joan.
Everyone agrees cigarettes are not good for you. Smoking causes nearly 500,000 preventable deaths every year. We all bear that burden, not only in losing loved ones, danger in secondhand smoke, and the burden on society, which includes our ever-increasing health insurance premiums. Adopting this addendum is a good way to very gradually decrease the amount of smokers. People who are over 21 and addicted to nicotine will still be able to purchase their products as before. This proposal will only affect those not yet 21 and not able to purchase nicotine products in Reading before they can become addicted. The gradual decrease in sales will allow vendors to find other products to fill the revenue stream. 20 years ago, smoking in restaurants was banned in Massachusetts. This was controversial at the time. Now it is well accepted, and in fact, many people can't imagine trying to eat dinner next to someone smoking. The mission statement of the Board of Health is to protect and promote the health of all the citizens of Reading and the environment. Nothing about smoking is healthy. This is a good way to both promote and protect the Reading residents. Thank you.
Thank you, Joan. Okay, so that was very helpful. It was good to hear all the different perspectives of this, very difficult decision for the board. And I guess the question is making a motion to adopt or not adopt, unless anyone else wants to make any other motion, can certainly do so.
So when would this be implemented?
It's effective January 1st.
So, I mean, we have time.
We have time.
You know, I'd like to hear everyone's ideas on my suggestion of having a full panel out here to give us more information.
My take, and interested in hearing others. You know, I love more data. I love data, and more information, and certainly making a decision, you want more information. From what I have read, and there are multiple countries where this is moving forward, and there are multiple, not only in this state, but there are other cities and towns in other states that have done this. I think it's probably early enough in the process to for there not to be an adequate amount of information and data that you can conclusively prove that this is, you know, this will clearly reduce smoking, not only in youth, but in general. And so where I understand the idea that whenever we make a decision in life, you always want to have all the information you could possibly have. I think it is something that is not likely available. I mean, I've never heard an expert. All the arguments I've heard around this have been around the things I mentioned. Not that it's not been proven, because it's a relatively recent phenomenon in the last few years, and there just isn't enough information. So I would not be in favor of, you know, going down a chase of trying to get more and more information. I don't think it's going to result in us really having all the answers, would be my sense. I don't know how anybody else feels.
I agree.
Carrie, Jones,
Yeah,
Carrie.
I think, you know, like you, I did some pretty exhaustive searching trying to make sure that I was getting all of the different perspectives on this. And I did check industry. I looked at, you know, publication from commentary about the regulation adoption and the bylaw adoption, in Brookline from industry. And there was no, like Rick, I have not seen anything, while there was commentary and suggestion that this was a equal protection violation, that this was a violation of individual rights. There was no other argument, and I don't see that. I have, you know, I have come to terms with the questions of those arguments. And while there may or may not, they're early, there may or may not be data on whether this will be effective or not. I agree with Paula. I think we try, and I'm not willing to wait and say that the potential to decrease the number of people who are addicted to this substance, the potential to decrease the incidences of cancers and other horrible, you know, experiences for people who started smoking when they were 15 and, you know, are sick decades later and miserable and often saying, gosh, I wish I'd never started. Yeah, to me, the possibility of that does not somebody might say it maybe doesn't work, doesn't outweigh the opportunity to improve people's lives now.
Okay, I mean, the only thing I would say to that is there's a good chance that you're going to enact this and there's a zero net gain. Actually, it's more probable that that's going to be the case. I think it's less probable that there's going to be an actual gain from this. I just don't think you can legislate the human behavior. I just don't think you can do it. I think they're going to move around that. I think they're going to figure out ways to either do it or not do it. And I think through education, it's been decreasing rapidly over the last 50 years, which is great to see, obviously. And I think a lot of the dredge on our system right now is from previous to that, right? So we're going to see a decrease as well in the effects of this as it goes on, whether this is enacted or not, just because fewer and fewer youth are picking it up, not carrying it into their adulthood. So that'd be certainly the first thing that I would say. But again, I just can't get past that sum block. I don't think this is going to do anything. And if it doesn't, why should we adopt it if it's really not going to have a great effect? And I'd like to hear how that a great effect could or could not be achieved before I made a decision. That's all. Go, Carrie.
If I may, Rick, I don't want to. Yeah, I mean,
sure, go ahead.
Whoop, sorry.
Go ahead.
I guess I go back to what Paula's insightful remark about how this substance is more addictive than heroin, and thinking about the things that work for heroin. It's the restricting of access, and it is the zero tolerance. That's the only way, because once someone's addicted to heroin, the challenge for them to kick that is very difficult. And I don't think I agree, actually, Kevin, that there won't be a net gain, and I'm not sure that I guess I'm not sure what you're basing that that statement on. If it's if it's a kind of a feeling in your judgment, and that's fine. But I think thinking about what we've done with other addictive substances, the restriction of access is the thing that you go to. And I'll just say too, while we're thinking about it, I think the idea of citation as an alternative is something that I don't know. It's kind of like the does it or does it not work for kids who know that it's illegal for them to possess alcohol underage? Is that a disincentive for them in alcohol use? And in my experience, it is for some, but not for many. So I think I'm not a big fan of that. And I think the question of enforcement is a real challenge. I think that we've heard time and again asking our public safety partners have indicated, what are the things we can enforce? What are the things we can't? Do you adopt something that you can enforce? And if they don't have the resources to do that, then it's not effective. And I think, if something's not going to be enforced, then why would we do it? So we certainly don't have the staff to do the enforcement on citing people under for smoking. So I'm good with our process, and I'm also good with if in a year data comes back, because there's been time on this and the data shows that there's been a negative effect, or that there's been zero effect. I want to see the data, and this is not my way or the highway. This is what I understand and have researched, and I think we've done a good process, and I think that we have considered all of the different factors well. So I am comfortable with proceeding with a vote, my opinion.
All right. Looks like I'm the minority on that opinion. All right.
So I'm gonna make a motion that we adopt effective January 1st, 2025, the following amendment to our tobacco regulations, and that is the prohibition of sales, No person, firm, corporation, establishment, or agency shall sell tobacco or e-cigarette products to anyone born on or after January 1st, 2004. Any person, firm, corporation, establishment, or agency who or which shall violate any provisions of this regulation and upon written notification shall be fined and suspended in accordance with the schedule set forth under the regulation of the Reading Board of Health restricting the sale of tobacco products. So I make a motion to adopt this amendment. Do I have a second? Paula, second. Roll call. Carrie?
You're
You're
muted.
muted.
Sorry. Yes.
Yeah.
Of course I'm muted.
Kevin?
No.
Paula?
Yes.
Joan?
Yes.
And Rick, yes. And so the motion passes. And I totally agree with Carrie that we need to track this over time and see what the outcomes are, and adapt as needed. But right now it seems like, for me at least, and for many members of the board, that it's the right move.
Just now that the vote is concluded, just as a final memo, more curiosity probably on my behalf. So I think there's a lot of things obviously we all agree on in regards to tobacco, the use of it. Nicotine's addictive a substance that is associated with it. So this is really me just asking kind of a question. If nicotine wasn't an allowable substance, would something like this even be necessary? And I'm thinking more on a big scale, right? So this is nothing you could do in the town or a state. This would be more of a nationwide. If you want to change a billion-dollar industry, you have to force their hand. So if it was illegal to use nicotine in the product, would that change opinions, do you think? Would it just be if there was no addictive substance in tobacco products, where things could easily be quit and easily use education as a source? I know I'm thinking on something that's probably never going to happen, and I realize that. So that's why I'm just kind of thinking out loud and leaving that thought out there. Because to me, that's really the crux of all this is the nicotine, more than the tobacco. I think you can educate away from the tobacco to your points, and you started this point, Rick, on a good one, that it isn't the choice once the hook is in, right? That's the problem is the hook more than the product itself. So just my last kind of food for thought there.
Okay, thank you. With that, I think we're going to move on to a day and the monthly report.
And hopefully we're going to stop receiving those emails.
Yes, I know.
Same format, multiple emails filling up my inbox, and my inbox is like, it's full, So hopefully, it got voted upon tonight, so I can start deleting emails. There will be no reason to keep those emails any longer. So I'm going to start deleting them. All right. So, so as you all know, Jennifer no longer works for the town. We're having a hard time filling the position. We actually got 2 good candidates. We offered the position to one of the candidates, and she accepted at first. And a few hours later, she, sent us an email rejecting it because of the salary. So yeah, I'm working with HR and the town manager to see if we can increase the salary a little bit so we can get qualified candidates. Again.
Yeah, can I ask a quick question in regards to that? How many other postings are out there in and around our community?
Like public
For
health,
the same type of position, yeah, for inspectors. Is there a lot?
A bunch of them.
So there's a bunch of vacancies in a lot of different towns.
Correct, and most of them pay more than what we're trying to pay.
Are we anywhere, and I don't want to discuss numbers in this meeting, but are we anywhere in the ballpark?
But considerably, yeah, we can say so. But I mean, if I'm trying to find a job and I see somebody that's paying $3,000 more and they offer me the job, I'll take it. It's as simple as that.
And not to further complicate your world and HRs, and hopefully I'm not stepping into that. But in theory, if one would go back to former employees with new salaries, just want to make sure we're keeping that on the table.
Okay. And the only other option would be to hire somebody with no public health experience. They'll gladly take the job.
Sure.
My job is going to be difficult because I'm going to have to spend time training the person. And once they get trained, they get all their certifications. Guess what happens? Out the door.
Of course, because they're going to go for more money.
Correct.
So, okay. So this, all right.
But, I think.
I wish this had happened before, but we didn't really have enough time, Carrie, at town meeting for this one, but could have probably juiced up that line item a little bit for you. So, okay. It is what it is for now.
A day, the salary difference is, between a very competitive salary versus what we're offering, it's about 5 or 10%. So it's not a small number.
Correct.
Right.
It's not a small number.
No.
Again, like we can get somebody for what we're trying to offer, but it's going to be someone with no experience in public health.
Entry level. Yeah.
Entry level, which is going to make my life more difficult. And
So,
I have other things as well to take care of. So
what is Matt able to do outside of town meeting to increase a salary? I can't imagine he can do it to the point where it's going to make, to Rick's point, that number kind of get a lot closer.
well, I don't want to speak on his behalf, but I know that in most municipalities, the town managers have the leverage to increase the steps.
Sure.
And the grades and things like that. So hopefully we'll see what happens. But
Okay.
going through the interview process and then offering the position, already setting things up, thinking that somebody's gonna start, and then we get notification that they're not starting. It throws us off. So hopefully, that won't happen again. And if we can't get the salary up, I just don't think it makes sense to keep interviewing people and then offering them the position and then, going in cycles. I don't think so. So I'm just going to wait for, whatever to happen to like bump up the salary a little bit and then go from there.
And,
Okay.
Sorry, Kevin, go ahead.
The only thing I was thinking is just, I worry about the street fair coming at the end of the summer. There's going to be a lot of vendors for you to have to do. Is Jennifer able to help us out on a pro bono, not pro bono, but per diem, excuse me, pro bono?
Yeah, she's been helping out, but obviously her new job is a priority at the moment. So anytime she has time to spare, she stops by, but it's not consistent, and I can't, rely on her at this point. So I'm gonna start tapping into the funds to see if we can get like an independent contractor to come in and help us out if possible, till we can find a full-time employee.
Okay.
Okay. Ajay, I just want to underscore what you're talking about the challenges of hiring someone without the experience. I mean, you have a full-time job. Your job is, and certainly your job is, you're supposed to be, you would be expected to do some training for a new person, but not training someone from the ground up. So I think the idea of hiring somebody with no experience and training up, sounds appealing, but in practice, what it will do is it will impact the office tremendously, because it will eat into the time that, you're doing other tasks.
Absolutely.
So I understand that, and I you know, as much as I like workforce development and pipeline and trying to get new folks in, I think that's great, but I don't think our office is in a position to really support that right now. And then I guess I'll just say too, because, you know, shared services, do you have access to any support from shared services should you need it, in addition to, you know, hiring somebody for, you know, independent contractor for Needham, for Reading specifically? Can you tap into shared services?
Absolutely. We've been doing that. Matter of fact, we had the Friends and Family Day, and to my surprise, only one person showed up. Just Paula showed up.
Oh gosh.
But
Thanks.
the
Sorry, coaching duties come first. Sorry.
I was there because I'm a lion. So
but you didn't show up at our table.
no, I was busy handing out pizza.
Oh,
Okay, but our shared services coordinator was present, and shared services nurse was present as well. So yeah, it was fun. We had a great time, you know. But yes, to your question, we have access to tap into the shared services resources,
Good.
and Annette is going to help us out with camp inspections.
Good.
Liana has been helping us out with Maven and disease investigations and things like that. So yes.
Good.
In the meantime, that's just temporary.
Exactly right. Nothing designed for permanent support. Nothing that can sustain permanent support. But you do have some, kind of ad hoc availability. Okay. I'm sorry about Friends and Family today. I have had a family medical emergency since the end of May, and I completely forgot. So sorry.
No problem. All right. So with that being said, the public health nurse position as well has been revamped. It's now going to be a shared position between the health department and the elder services department. Mm-hmm. So we were having a hard time filling the position based on the salary. And I came up with an idea to merge the positions so that we can increase the salary, and then we'll have the person work for the public health department and elder services. So the select board just approved the new job description. It's been posted. It got posted earlier this week or late last week. I'm not sure. Don't quote me on it. But we're hoping that before the end of the month, we'll start conducting interviews. But last time I checked, I didn't really see any applications, but there were some people we interviewed back in February, March. I think we can still reach out to them if they haven't gotten any jobs, but we'll see.
What would the FTEs be on that position? And is it going to be adequate for the two?
Yes. So the way we're looking at it, it will be up to 15 hours for the elder services department. They came back and said they wanted more. So pretty much we took out the hourly limitation. So we're just gonna share it. Whoever needs it the most will get it. So that's. Okay.
I just don't want something like that to be a deterrent for applicants. I love the idea, though. I think it's a great idea to increase salary. You should put the salary on as the first, the range of salaries, the first line item on the posting.
Yes, I believe that's what we did on the new one, on the new job description. So we, by merging it, the senior services was able to, get some savings to apply to other things, like social work and things like that. So they're going to take some of the funding that they're saving and apply it to social work and things like that. So it's a win-win for the town.
Yeah.
So we'll see what happens.
Great idea.
Yeah, we can always try, and if it doesn't work out, we can go back. In terms of inspections, we conducted 15 comprehensive food inspections. We issued 6 temporary permits. Richardson Ice Cream pretty much closed last month. We also had 2 solid waste complaints and inspections. In terms of disease surveillance and this data, I got it from the shared services nurse. So, you know, they're helping out with something. But the only other issue that we have is we've not been able to execute the IMA because, you know, the attorneys could not pretty much agree. So last minute, the North Andover attorney, you know, town council added a couple of lines to the IMA, and it pretty much threw everybody off, and nobody wants to agree with it. So we're trying to see how we can work around it and get an agreement going, because the staff are starting to lose confidence. So for example, we hired a public health inspector for the shared services. She accepted the position, but she, you know, she pretty much told us, hey, I have a job and I'm not gonna leave my job if you guys don't have an agreement signed. Because if you don't have an agreement signed and I quit my job, and I get an agreement in, then I don't have a job. So pretty much, you know, people are starting to lose confidence if we don't get this IMA signed. You know, I know that the shared coordinator is very concerned about this as well, because her job, you know, her livelihood depends on it. The nurse as well is not too happy about it because her livelihood depends on it. So we're doing everything possible to get this IMA signed. You know, we'll see what happens.
Carrie, did you have a comment?
Yeah, Day, I'm sorry to hear that. And just because I have a little more knowledge about this than, is your shared service arrangement using the technical assistance that the state provides from the attorneys to try and
Correct.
get? Oh,
yes,
good,
so that's
good.
how we're trying to get around it.
Good.
Some people have suggested that we dismantle the, you know, pretty much dismantle and then form a different group. But the state won't allow us to do that. Some people have also suggested that we transfer the host municipality to somebody that's willing to do it, but the state won't allow us to do that. But just my personal opinion, I feel like the state has invested a lot in this, and I feel like, you know, they can probably find some type of loophole for us to, you know, move things around. We don't want the same situation as Methuen and Lawrence, or, you know, we don't want that.
But you're not really in the same situation as Methuen and Lawrence. It's
correct.
I mean, no disrespect to them, but their challenges are very different, significant, really. Yeah.
Right.
But okay. All right. Well, okay. I'm sorry that's happening. I hope they will, I hope that technical assistance will be able to prevail, or that the state they will be able to communicate with the state to explain the precariousness of this. So
I hope so too. And right now that we're short-staffed, we need them. So all right, in terms of disease surveillance, we let's see, we had, so prior from last Board of Health meeting to today, we've had 1 confirmed case of Group A Streptococcus, 1 confirmed case of hepatitis B, 1 suspect case of hepatitis B, 3 confirmed cases of influenza, 2 probable cases of Lyme disease, 1 suspect case of Lyme disease, 5 confirmed cases of coronavirus, 1 probable case of coronavirus, 1 suspect case of coronavirus, and 1 confirmed case of tuberculosis. Yes, so that pretty much concludes it for me.
Thank you, Uday.
you.
In terms of final comments, I don't know. I think everyone knows that Paula has decided to step down um, from the Board of Health at the end of her term, this makes it, I think, her last meeting.
Yes.
And Paula, I wanted to thank you for your service over the past 4 years. I mean, you were appointed to the board in the middle of the pandemic, at the beginning of the pandemic in 2020.
Yep.
And, you've contributed a lot, with your insights and suggestions. And of course, the meticulous read of our minutes, which has raised the standard for all of us. I think your nursing perspective was always very helpful, as well as your advocacy for drawing the religious community into the public health work. You mentioned that on several times. You've really rarely missed any meetings. And I think we've achieved a lot in the last 4 years. We got through the pandemic, shored up the health department before it's kind of a little creaky now, but we're getting there.
Yep.
And completed this whole health assessment and health improvement plan. And so, you've been part of all of that and a real contributor. And I just want to thank you for your service.
You're more than welcome. It's been such a pleasure and an honor to work with all of you. You've all brought such expertise to this. I'm not sure how much the public appreciates how much expertise we have on this board. And the fact that we can respect each other's opinion, even though we don't always agree, and get work done, good work done. We've gotten some really important things done in the last few years, and I'm very proud to be a part of it. And I thank all of you.
Congratulations on a 4-year run. That was really, we got a lot done. More we think back on it now. I mean, really, there was a complete restructuring of the health department.
Yep.
So I mean, there's a lot that you get to look back on and say, I was part of that, and it was good work, and you always showed up with a great perspective. So I always appreciated that, Paula, of you.
Thank you.
Best of luck in your second retirement.
Yeah, well,
You stole my line. I was going to say that.
now we get to take care of all the grandbabies.
Oh, Paula, we're gonna miss you. You and I came on together, right?
Yes.
So I kind of feel
Yes.
like we were, we were marching along together and not always agreeing, but always hearing, I mean, just always working things over and trying to find out what the best public health solution was. And it's been a real pleasure to get to serve with you. You're smart and you're thoughtful and you're really a you're a nurse. the public health nursing is so important. There's so many different things you bring, and we're gonna miss you.
Thank you. Thank you.
Thank you for being part of us.
My pleasure.
Right. So I just want to thank you for your service, Paula. It's been great working with you, and thanks for always editing minutes.
You'll never forget that, will you?
I'll never forget that wherever I go. Thank you so much. You're going to be missed, and
Thank you.
Don't be a stranger. We're
No.
going to be expecting you at the next Friends and Family Day.
Absolutely.
Good luck.
Thank you.
So if there aren't any other thoughts or comments, I'll make a motion to adjourn. Do I have a second? Oh,
Before we do that, are we meeting in July? I know typically, historically, we've taken
good
that off.
point. Yes, good point. No, we do not have a meeting scheduled in July. And obviously, if there's an urgent situation that we need to address, we will call a meeting. But otherwise, our next meeting will be the second Thursday in August.
Okay.
Thanks for reminding me that I was going to mention that.
And I will inform the board if we have emergencies or something really urgent that the board needs to take care of. I'll let the board know.
Great. Again, motion to adjourn, a second?
Second.
Kevin?
Actually, wait a minute, Paula.
Paul, I guess.
Well, second.
Carrie, yes. Kevin?
Yes.
Joan?
Yes.
And Rick, yes. All right. Have a great summer, everyone.
Goodbye.
See you
Good
in
luck,
August.
everybody.
Bye.
Bye.
Night,
Hope to see you around
everybody.
town.
Thank
See
you
you.
all.
I know I'll see you around town.
Absolutely.
Yes.
Recording
Bye-bye.
stopped.
Bye.